Good morning and welcome to WellLink Health Alliance's Healthcare Cybersecurity Virtual Symposium. I'm Brian Lane, President and CEO of WellLink, and it's my pleasure to kick off today's program. In today's healthcare environment, technology surrounds us. It enables seamless communication, cloud-connected medical devices, faster diagnosis, and more efficient organizational operations. But with all of those benefits, it also comes extremely unique risks. A cyber attack on a hospital or healthcare system is more than just a data breach. It can be disruptive regarding the care, the delay of treatment, and even compromise patient as well as staff safety. When we designed today's symposium, our goal was simple: to address the growing challenges in cybersecurity by offering attendees a meaningful insight from experts with deep knowledge and real-world experience. This meant bringing together healthcare's leaders, national experts, and industry advocates across IT, security, clinical operations to examine the evolving threat landscape and the strategies needed to strengthen healthcare's digital defenses. We know that every organization has its own vulnerabilities, but many of the risks are shared, and so are many of the solutions as well. Today, you'll learn from true leaders within the field and gain insights on how to safeguard patient data and maintain operational continuity through practical insights, peer learning, and actionable strategies to enhance organizational resilience. What I hope you take away from today goes beyond simply just information. First, you'll gain a clear understanding of where the risks are and how they are constantly changing. Second, you have the opportunity to bring back practical tools from lessons led by policy and compliance experts and cybersecurity procurement professionals. And the knowledge you'll gain from participating in today's simulated cyber incident tabletop exercise is truly invaluable. Opportunities for this type of hands-on training are extremely rare. Finally, and perhaps most importantly, I want you to walk away from today's event with a sense of community. It's important to remember that you are not facing these challenges alone, and today you have the opportunity to learn not only from our speakers, but from one another. Network. We want today to be engaging and interactive. I encourage you to use the QA feature throughout the day to submit questions for our speakers. Your input and curiosity help shape the value of this experience for everyone, and especially for ongoing events as well. One of the things I'm especially proud of is how this event underscores WellLink's commitment to helping our community prepare to face modern risks. Our vision to be a catalyst for transforming total well-being is what guides WellLink each and every single day. And that is what leads us to focus on cybersecurity today. Cybersecurity is an issue that needs to be taken extremely seriously because it's integral to maintaining the trust that communities place in their healthcare providers. And at WellLink, I'm deeply committed to ensuring we remain at the forefront of this work. Before we get started, I'm going to take a few seconds here to thank everyone who made today's event possible. First, thank you to all of our speakers who generously volunteered their time to be here, and thank you to our team here at WellLink for bringing together this amazing event. As you've noticed, today we're using a virtual platform designed to recreate the feeling of an in-person symposium. I'd like to extend a massive thank you to ecfirst for helping us deliver this full day of sessions in a seamless virtual setting. Thank you, ecfirst. And a heartfelt thank you to all of our attendees today, each and every single one of you. Your participation and perspectives shape our conversation today, so thank you for being here. Today we'll learn from an incredible roster of speakers. Aidan Klein from Premier will delve into what federal action means for healthcare providers. Edward Estrada, also from Premier, will discuss the importance of conducting due diligence when procuring cloud-connected technologies. And facilitated by Eric Ramirez from P5 Cyber, we will close the day with a tabletop exercise simulating a cyber incident, giving you the opportunity to put strategies into action. We have had the pleasure of working with Eric in the past, and I can say with confidence that he knows what he's doing. You will not want to miss this session. This guy is super hands-on. But first, we'll start the day with a keynote session from the renowned Ali Pabrai. I've known Ali for a long time. 20 plus years. 20 plus years. That's just amazing to me. And I've had a tremendous respect for him and admiration for his expertise. When we were putting this event together, I immediately knew we'd want you to have the opportunity to hear directly from him. Ali is a global AI, cybersecurity, and compliance expert. He's the chairman and chief executive officer of ecfirst. I'll say that again, ecfirst. As a highly sought after professional, he successfully delivered solutions to U.S. government agencies, IT firms, healthcare systems, and many other organizations worldwide. He began his career with the U.S. Department of Energy's nuclear research facility. He then went into Fermi National Accelerator Laboratory, and since then has served as vice chairman in several senior positions with NASDAQ-based firms. He's a globally renowned speaker. He's been featured as a keynote as well as moderated numerous cybersecurity conferences throughout the whole world. He is an author of several published works, and we are super happy to have him here today. Today, we'll have an in-depth look at the current threat landscape in healthcare and share the insights to help leaders like you stay ahead of the emerging risks. Please, everyone, hit your emojis and please join me in welcoming Ali Pabrai.
Good morning, everyone. Really excited to be here with all of you today. Appreciate, like Brian mentioned, all of you making the time. Like Brian mentioned, a terrific lineup of speakers. I'm looking to learn from each and every one myself today. And just wanted to echo what Brian said. We've known each other for a long time, and we're always learning and sharing throughout our journey in the healthcare space, especially some of the things that Brian mentioned with respect to the challenges that we face with respect to threats to patient data, patient information, but also the opportunities that are there in front of us that we can seize and take advantage of. So the focus of my presentation over the next 45 minutes or so is to really look ahead to 2026, kind of how should organizations be looking at the threat landscape, if you will, in healthcare. And one of the things we've got to remember, we live in a world that is flat and getting flatter, Thomas Friedman. And, so threats may be global, the impact is local. And so that's what we've got to be really prepared for. I think for me, I like to keep things really simple. When we look at the current threat landscape in healthcare, that's the risk that we are surrounded by, and no organization has or is or will be 100% secure. We are always going to be surrounded by risk. To me, the word that is really important, that's a takeaway from this session, from this symposium, is resilience. Is how can you and I and all of us together establish resilience in our computing ecosystem? I think that's really important so that we can give confidence to all of the shareholders, to all of the stakeholders in terms of patients, physicians, and all others that are in the community, as Brian had mentioned. You will have access to all the slides. Also, on the bottom right, I don't know if it's readable or not, just send a request to whoever your point of contact with may be. And my team put together this thing with the T-shirt, "In God we trust, the rest we audit." So if you'd like to get this T-shirt, just send a note. You'll see my email also at the end, and we'll be happy to get that to you. And like Brian had mentioned, I don't like to talk about myself, but just a couple of quick things in terms of looking at the future. On the bottom left are a bunch of logos out there. The key takeaway from that is, as we look ahead again to 2026, I'm always looking for what are the opportunities out there for each of us professionals. And there's a new standard from the Department of War, Department of Defense, the Pentagon, which is CMMC, Cybersecurity Maturity Model Certification. And the top row of logos that you see in the bottom left all relate to CMMC. I've been immersed in the CMMC ecosystem for the last, I think, 4 or 5 years, and deliver a lot of certification training related to CMMC. But CMMC is an acronym that you're very likely to hear in your journey ahead and I just wanted to bring that to your attention. So, like I mentioned, I like to keep things simple. There's a lot to unpack here, so to speak, in terms of the state of HIPAA compliance, Health Insurance Portability Accountability Act. We're all familiar with that. But in the last 12 to 18 months, OCR, the Office of Civil Rights, has been enforcing HIPAA at a rate that we've not seen before. And these are seven-figure risks to the organization. Married to that, we'll take a look at AI risk. And so there's a lot of threat and risk to patient data, patient information, assets from AI-related attack vectors, and we'll take a look at that. I think it's really important when we look ahead to 2026 that we integrate our HIPAA compliance program with AI risk management. And we'll talk about that fusion in terms of how can organizations address that. And what really comes to mind is establishing a credible AI governance program. I think many organizations are on the fence or have just started putting together the AI governance program, and I want to talk to you about that, especially because there's a really valuable reference. And throughout my presentation, I'm going to be sharing key references that I think are important for all of us in leadership, in management, professionals to be familiar with, to be aware of when it comes to AI risk management. Another really important standard that's out there in the industry is high trust. And what's really amazing about high trust is that high trust has now provided full support for some of the AI risk management standards that are out there, both within the United States and globally. And so when we think of global standards, we think of one organization, which is ISO, International Standards Organization. All countries in the world follow the ISO standards, and ISO has introduced standards as it relates to AI risk, and we'll be taking a look at that as well. And how is that integrated within high trust? The key takeaway with this fourth area, high trust in AI, is there's a real opportunity for organizations to achieve certification. High trust certification brings a lot of credibility to the cyber and AI defense programs of an organization. Two states in the US that are really at the forefront when it comes to compliance and cyber and AI mandates would be New York, and the other one that you don't see here is Colorado. And I think we can learn a lot by being more knowledgeable about the mandates from New York and the mandates from Colorado. I'm going to provide you with some insight on that. And the reason I've included that is because even though you may not be in New York or you may not be in Colorado, but that's where compliance and cyber standards are headed. So it's very important to be aware of what New York requires, what Colorado requires, and see if we cannot use that to elevate our policies, our procedures, to build a more resilient program. And then finally, I'm going to close by taking a look at, all right, we understand the risk, we understand the threats, we understand the disruption that Brian was talking about to patient safety and patient care. So where do we go from here? What are some important steps that we can take now before the end of the year to position ourselves really, really well and with confidence in 2026? I would encourage you to send your questions, and at the end of the presentation, would be happy to do my best to answer your questions. If there are any questions I'm not able to get to or unable to answer, we'll be happy to research that further with my team and others and come back to you. We are just so excited and thrilled to have you participate in this WellLink symposium today. So, as I said, want to keep things simple. When we look at the state of compliance, and this is very current, very fresh information, on the left side are all the fines and penalties that have been enforced by OCR, Office for Civil Rights. And you can see that typically these fines are seven-figure fines, but the remediation for these fines is a number that's much larger. So it's really, really important that organizations, the board of directors, senior leadership recognize and understand that it is really important to establish a cybersecurity and compliance program that is in fact providing and delivering resilience. One of the things you'll notice on the left side are the types of attack vectors that hackers are using to compromise patient data and assets within an organization. So, for example, on the top left, unauthorized access, individuals who should not have access, and this could be internal, this could be external. Credential stuffing, that's a huge risk to organization. A risk that is going to persist with us, and it's really important, and I've got a couple of slides on this, is ransomware. I think it's very important for organizations to build a strong ransomware risk management program. Organizations, some of you may have experienced ransomware. I think the risk from ransomware is very, very significant because of the attack vectors related to phishing from email type attacks. Data breaches, like Brian had touched upon during his introductory remark, and then improper disclosure. That word disclosure has special significance from a HIPAA compliance perspective. Disclosure is the movement of any data, any information outside of your organization. So if you're working with business associates, and this is where you got to think of the supply chain. And the question that we've got to ask ourselves is our supply chain resilient, right? The supply chain, like I mentioned earlier, is global. And so we got to make sure that there aren't weak links in that supply chain that can compromise our data. So when you look at the word disclosure, and this is emphasized significantly in HIPAA privacy, in HIPAA security, it is the movement of patient data and patient information outside of the organization. So you may be working with business associates in Europe, in Ireland, in India, in Philippines, in other countries. You are responsible for making sure that your supply chain is protected, is appropriately complying with the HIPAA mandates. On the right side, there's an area that I call HIPAA's blind spot. And many organizations have not been paying attention to this, but there have been significantly higher OCR and other settlements that have taken place when it comes to online tracking. So what is online tracking? Online tracking is you've got a website, all of us have websites, and a patient comes into the website for a hospital or a health system. Brian knows the hospital health system industry inside out, outside in. 6,000 plus hospitals across the country, rural hospitals, medium-sized hospitals, larger health systems and all of that. But all of these organizations have websites, and when a patient comes into the website and is looking to make an appointment or is looking to gain access to their healthcare information, is that information being shared by anyone outside? Are there marketing tools that you've implemented and deployed that is analyzing that information? And so that's disclosure of information, and got to make sure that that information is appropriately protected with business associate agreements. And one of the things that organizations have to do that many organizations have just not done, it's something that organizations should be looking at in the first quarter of next year, is performing an online tracking assessment, what I refer to as OTA, online tracking assessment, within the scope of your HIPAA compliance assessment. So again, the risk from this is not insignificant, as Brian mentioned, very disruptive. And we got to make sure that we've got an appropriately positioned HIPAA compliance program based on how OCR is providing guidance in the enforcement of HIPAA in 2025 and looking into 2026. On this slide, one of the things I wanted to mention, this is again in the last, you can look at the dates at the bottom of your screen, October 14th, October 6th. So this is very recent, just a few weeks ago. And these are not fines from OCR, but another area that we've not been prepared for, which is class action lawsuits. And this again is not a 7-figure risk, it's an 8-figure risk. And we've got to be paying attention to making sure that we've got the appropriate defenses in place. I mentioned earlier ransomware attacks, and I just wanted to kind of do a deep dive, if you will, into a particular ransomware attack that took place. What was the process that had been used by the attackers, the consequence, if you will, and what are some lessons learned in terms of what can we do to improve. So in this case, this was a $3 million OCR HIPAA settlement as it related to ransomware. This occurred back several years ago, between April and June of 2019. OCR was informed, OCR got the breach report. The date of the fine was earlier this year in January, and 2-year cap. What is cap? Cap is a corrective action plan, which means that over the next 2 years, OCR is going to be monitoring this organization very closely. Quarterly reports required in terms of the overall HIPAA compliance program. That 2-year monitoring itself is an 8-figure risk to the organization in terms of putting in the controls and capabilities to support that. On the right side, you can see the attack vector that had been used. What happened? Multiple HIPAA security and high-tech breach failures within the organization, and the organization failed to implement security measures. That word measures is very important. It refers to security controls. And because we are now at the start of this AI impact on all aspects of the organization, I think it's very important for all of us to take a step back and understand what are the security controls that we've deployed. Security measures are security controls. What are the security controls that we've deployed that we must integrate AI capabilities in? It's really, really important. So what are some of the lessons learned in order to be better prepared for ransomware in 2026 than we were in 2025? We should conduct accurate, thorough, regular risk analysis, strengthen email security controls, because that's where phishing attacks come in from, ensure timely, compliant breach notifications. Now, HIPAA gives organizations 60 calendar days when it comes to breach notification. I am coming to you from Irvine, California, the state of California. In California, when we look at healthcare-related privacy security mandates, the breach notification period is 15 days, 1-5. So as you can see, state mandates in certain states could be stricter than the federal mandate. Later, towards the end of my presentation, when we take a deeper look at New York and Colorado and some of the other states, we'll notice that it's no longer 60 calendar days or 15 calendar days. It's about 72 hours when we have to look at breach notification. And so when you look at your compliance program, your cybersecurity program, I think organizations, and when they look at incident response, incident management, cyber incident response, cyber incident management, organizations should be looking, the magic number now, when you look ahead to 2026, is no longer 60 calendar days, no longer 15 days, it's 72 hours. So within 72 hours, that's not a whole lot of time. It means that you've got to have automated near real-time capabilities to discover these attacks that are taking place so that you can get enough information to mitigate the attack and also go through the breach notification process. And one other thing I just wanted to mention before I forget, which is that the breach notification tied into these ransomware attacks, and this is just one type of attack vector. There are many different types. There are dozens of attack vectors. But the breach notification, what we have to all be aware of, there are federal mandates and there are state mandates. So you may have to follow the mandates of several states, and it's very important, the secret sauce, because we don't have sufficient resources. It's very important to find out the state that has the strictest mandate and use that as the floor for your compliance program. Over here on the right side, I have summarized some of it's like a checklist, if you will. I've summarized some of the action items that organizations should be looking at after this WellLink symposium, and just ask the question, hey guys, are we doing this within the organization? And if not, why not? Can we take a look at some of these areas? On the left side, there have been 15 enforcement actions by OCR just only on ransomware. We're not talking about all the other HIPAA enforcement that is taking place. And that is very, very significant. And the message that OCR is sending to the healthcare industry and the associated business associates, take this seriously. Protect patient information, implement appropriate security controls. So when you look at the list that you see here, there are about 10 items. Review vendor and contract relationships. Those are your business associate agreements, and that's what you see on the right side. Ensure that the business associate agreements are in fact appropriately updated, that we are not using business associate agreement templates from 10 years ago for new contracts that we're signing right now. address breach and security incident obligations. These are the obligations in terms of federal and state mandates. Ensure audit controls are appropriate. Multi-factor MFA authentication. It's a necessity now, and organizations must implement MFA within the ecosystem, the computing ecosystem. Encryption. The three most powerful words in real estate are location, location, location. And no one listens to me. I feel like I'm always talking to myself. The three most important words in cyber defense: encryption, encryption, encryption. So even if an attacker is successful in compromising your assets, but you have appropriately encrypted that information, hey, it's still good. It's still good because they are not able to gain access to that patient data. And then training, I think as we look ahead to 2026, and this is where you'll see there's a credential on the bottom right, AI CRP. This has been developed. We are very excited to be partnering with WellLink on this credential, AI CRP, AI Cyber Risk Professional. It's an online program, but training of that type, you want to make sure resonates across your organization through all members of your workforce. I hope everyone is super excited. It's about 6:30 in the morning here in California. I couldn't be more thrilled with the start of the day with Brian, with Endrid, Hassan, and so many others associated with this symposium. Control your excitement. All righty. So we took a look at, kind of chapter 1 in terms of the risk out there from OCR, and that is not insignificant. That's what we've got to make sure we take that into account. And now let's take a look at, we are surrounded by AI and the risk associated with AI. So I've been doing a lot of research over the last several months, trying to understand all of these AI-related attack vectors, and I wanted to simplify that for our audience and this symposium. And what you see in the slide is the secret sauce that all attackers use when they're looking to integrate AI in their attack as an attack vector. So reconnaissance, because there's a lot of information about you and me that's out there in social media. If you look for Brian Lane, or you look for myself, or you look for Endrid, there's more information out there than we would want to see out there on us. So reconnaissance is very important because that's how AI gathers a lot of information within seconds, and then that information is used to target and exploit the vulnerabilities that may exist. Weaponization, AI aids in the creation of new multi-stage payloads that becomes very difficult to detect for organizations with the current tools that have been deployed. Gen AI targets employees with highly personalized phishing emails. So we used to all get these phishing emails, but now these emails are so personalized, it's very hard to detect, hey, is this real or is this not real? And once you click on that, that's where malware is deposited on your computer, and it's kind of game over at that point. Exploitation is because all of us in our computing ecosystem, there may be vulnerabilities. So if we are not performing cybersecurity assessments, penetration testing exercises, those vulnerabilities, we will not know about it. Attackers know about it, and they'll be able to exploit that. Malicious scripts generated by Gen AI to evade threat intel-based security controls. Command and controls, because Gen AI scans the web for new channels to disguise remote communication. And at the end of the day, number 7 is where I want to spend a few seconds on. The attackers have 2 objectives. It's very simple. Number 1, they want to try and elevate their credentials within the organization to get more privileged access so they can compromise assets of higher value, your mission critical assets. So that's one, credential escalation. And the other is exfiltration. They want to move data from your organization outside, right? That's like your patient information and all of that. Those are the 2 core objectives of attackers out there. So it's very important that we take a look at that, understand this is the script, if you will, that attackers are using, and put together a program that has the appropriate defenses to protect against it. I try to flip the way we look at AI cyber threats into different attack areas. So what you see in the middle of this graphic, and it took a long time for me to put this together. It looks like it's a simple slide, but it was very difficult. I was trying to make sure it's very simple to communicate the message. At the same time, this should be like a checklist that organizations use when they're looking to elevate cybersecurity program. So the major areas that organizations have to be looking at and ask the question, do we have the appropriate cyber defenses, are availability attacks, input-based attacks, poisoning attacks. So when we talk about poisoning attacks, data poisoning, model poisoning, I mentioned cyber chain already several times, cyber chain attacks where there are third-party training data sets may have been compromised, or the models or the code, and then threats inherent to current state language models. These are 5 major areas that we should be looking as we look ahead to 2026, that organizations are in fact appropriately addressing in terms of AI cyber risk. So a lot of information. Just to take a step back, we've already talked about the requirements for HIPAA compliance going into 2026 because of OCR enforcement. And we have to look at the OCR resolution agreements very seriously, because that's where your compliance programs for HIPAA need to be focused. Then we looked at the threat in terms of the AI factor. And now I want to talk to you about governance, AI risk management. What is out there that we can lean on? So here we're going to look at what are the solution opportunities for professional senior leadership and the board of directors. So the most important organization for us within the United States is NIST, National Institute of Standards and Technology, NIST. And NIST provides really valuable, I cannot emphasize this enough, NIST provides really valuable references for HIPAA compliance. In the area of HIPAA compliance, the document, if you haven't read it, you should. It's NIST Special Publication 800-800-66. So make sure you get the latest version of that document, NIST Special Publication 800-66. That is the important, one of the most important references when it comes to HIPAA compliance. On this slide, what I've tried to do is try to keep it simple and focused on, from a risk management perspective as it relates to AI, what are the resources out there? And every organization in the first quarter of 2026 should be looking to perform a AI risk management exercise based on NIST AI 100-1. This is the Bible, if you will, for us in the United States, and healthcare organizations should be focused on NIST AI 100-1. There are 2 sister publications to this document, 100-2 that provides more detailed information in terms of the cyber threats I've been talking to you about. And then what was relatively recently introduced, AI 600-1. The only big difference between 100-1 and 600-1 is 600-1 covers Gen AI, the risks associated from Gen AI. Now, on the bottom right, the document that is a very readable document. And if I were you, I would cancel my plans for tonight. What could be more exciting reading than AI RMF Playbook? All right. It's a couple of 100 pages. Sit down, read through this document, and you will get valuable insight in terms of where does my AI governance program need to be within my organization. And I think you'll get a lot of good ideas. There's a lot of good content in the AI RMF Playbook. So the secret sauce, and I say this and I feel like I'm talking to myself, listen to me. The secret sauce when it comes to AI governance is hidden in this document, AI RMF Playbook. Read that document. That really will allow you to establish, kind of set the bar for AI risk management within your organization. And you should be aligned, because if the board is asking, what are we doing with AI? How are we addressing AI risk within the organization? You can come back and say, we are building an AI governance program that's completely aligned with NIST AI 100-1, 100-2, and 600-1. That provides a lot of credibility. That provides a lot of confidence, right? Now, wanted to dive a little deeper. This is as deep as we get, but I think it's really important for you to understand what is there in this AI NIST body of work. And this slide answers that question. So I've taken a few 100 pages of content and reduced that to one slide. Hopefully this makes a lot of sense. On the left side are the functions. Now, many of you may be familiar because we've got a lot of, Brian mentioned, we've got a lot of cybersecurity experts that are listening in, that are attending today. Our speakers are amazing. The lineup that Brian and the team have put together. NIST has organized all the requirements into functions, categories, and subcategories. So on the left side, the question I always ask is, what are the functions that are in this AI risk management function core? And it's govern, map, measure, manage. 4 functions. So there are 4 functions. You can see that in the center. It's organized into 4 functions. That's what we have to address. Now, functions consist of categories. And there are 19 categories across these 4 functions. And these categories consist of subcategories. And there are 72 subcategories within these functions. The number 72 is important because that is what the NIST AI governance body of work is requiring, is that we take a look at these 72 areas within our organization and we assess to see, are we meeting the requirement or are we not meeting the requirement, right? So it kind of establishes a baseline, and then you perform this exercise on a regular schedule, at least annually. So governance, functions, and the associated categories and subcategories impact the entire organization. A culture of risk management is cultivated and present. Map is the next function. Context is recognized. Risks related to context are identified. Measure is important because you want to make sure you get metrics in place. That's what measure is all about, putting metrics in place. Identified risks are assessed, analyzed, and tracked. And then really important when we think of these functions within the NIST body of work for AI governance, the manage function. Risks are prioritized because not all risks are equal. So you want to prioritize these risks, and they are acted upon based on the projected impact to the organization. At the end of the day, the magic number from this slide and my presentation as a whole, when it comes to AI cyber risk, it's 72. There are 72 very specific areas that we must address, that we must know the state of our compliance program as we head into 2026. So here you can see on the left side, I just showed you what the cover page of the AI 600-1 NIST publication is about. And this focus, like I mentioned, is on Gen AI and managing. It's a sister document to the AI RMF 1.0 from NIST. So that is 600-1. Now, let's leave the US and travel outside the US. Outside the US, if you were to be in Europe, I was in Ireland some time back, and just as I was coming to Ireland and I was about to speak at a conference, at that time in the 4th quarter, I believe, of last year, the European Union introduced a new EU AI Act. So in Europe, the AI Act is really important, and we'll talk about that. But equally important, Europe, Australia, Japan, Canada, all these countries give a lot of emphasis to the ISO standards. This slide simplifies it. It tells you what are the really valued ISO references that you and I cannot be illiterate to. So even though we are here in the US, we have to be knowledgeable about these ISO standards because they provide an excellent framework for AI governance. On the left side, the foundation for the ISO AI standards is 23894. That's the place I would start from. The next one that you can achieve certification against is ISO 42001. And here, this is about information technology AIMS. That's the key acronym to remember about 42001. Some of you may remember with 27001, the key acronym is ISMS, Information System Management Solution. Here, Information Security Management System. Here, the focus is on Artificial Intelligence Management System, 42001. Really important. You're going to be hearing a lot about 42001 in the years to come. But the document that gets me really super excited, I'm not just excited about, super excited, okay, is ISO 27090. Every day I wake up, I don't say good morning to anyone, my wife, my kids. I'm like, what is the state of ISO 27090? and it's in a draft state. The good news is the draft has been published. You can Google and gain access to it. But why is this document so important? It is at the crossroads. It's the first document globally that the world agrees on. We in the world don't agree on anything. Okay, it's the first document that's at the crossroads of AI and cybersecurity. It's a required reading for any one of you that are listening today. You got to make sure you keep your eyeballs on this document 27090, because once this document becomes final, if I were in the board of directors or in senior leadership, I'd be telling my team, I want to make sure my compliance program, I want to make sure my AI governance program, I want to make sure my AI cyber security program is 100% aligned with ISO 27090. So keep a close eye on that. And when I studied, I walk around with this document everywhere. I go to Starbucks, I'm reading it. I'm standing in line at the grocery store, I'm reading it. Okay. So as I was reading it and kind of digesting all that information, this slide comes out. You don't know how many hours of effort I've put in. I've lost a lot of hair. I don't have much hair left. It's all white. But it kind of synthesizes some of the information that's in. This is at the core of ISO 27090. These are the 12 AI attack threats that they are giving us guidance that we got to make sure that we are protecting our computing environment, because this is what the future looks like when it comes to attacks coming into our infrastructure. 12 areas, really, really important. And by the way, send me an email after the symposium is over. Listen to all the speakers, get all of the information. I've put together very simple one-page infographics. I'd be happy to share that WellLink, and we have collaborated on a lot of materials for our audience here today, and we'll be happy to share that with you. So ISO, what are the numbers? Don't forget 23894, 42001, 27090. Those are the magic numbers, right? Remember it. Now, the EU AI Act, if you're going to be doing any work with any business in the European Union, this is a mandate that you've got to be in compliance with. For many of us that have been in this space for a long time, GDPR is what we are familiar with. If you're doing any work, GDPR establishes the foundation. It's the equivalent for HIPAA for healthcare. It's GDPR for the European Union when it comes to personal data, personally identifiable information for European Union residents. And the next act that is very, very significant is the EU AI Act. And so be familiar with this, because the objective of this act, which was passed in 2024, is to regulate AI technology. What I thought was really amazing when I was studying the EU AI Act is the way they've really organized AI risk into 4 areas. And so I think every time you read some of these bodies of work, they give you ideas that you can incorporate within your organization's AI governance program, right? Moving on to high trust. So within the US and globally, high trust is another important emerging certification standard for compliance and cybersecurity. Now, some of you that are in attendance today at this WellLink symposium, you may already be a high trust certified entity, right? And because of HIPAA, you may be looking to achieve high trust certification based on, because you're in the healthcare space. So for example, item number 22 on this slide relates to HIPAA. So does number 25, 26, 27. So what High Trust has done is High Trust has looked at all of the American standards when it comes to compliance and cybersecurity, as well as global standards. So you can see 30, 31, 32, 33, 34, 35, all of that relate to ISO. So High Trust provides a really great opportunity for organizations to pick and choose which mandates, because not every mandate impacts every organization. You can pick and choose which mandate impacts your organization, and then you can achieve certification against those mandates. This is all based on the current High Trust CSF version, which is 11.6. And from an AI perspective, when we look at High Trust from an AI perspective, there are 45 requirements, as we can see on the right side, 45 requirements when it comes to High Trust. And those are broken into these areas that you see on the left side of your screen. So HITRUST does provide an opportunity for you to achieve certification as it relates to the state of AI within your organization. And the areas of risk from the HITRUST perspective is 41. So here you can see in the middle, it says AI security requirements. It means that have you addressed the AI risk in these 41 areas appropriately? So HITRUST is a great opportunity for organizations to achieve certification and bring credibility to your compliance and cyber program. Moving on to New York. So again, like I mentioned earlier, many layers of really valuable. I've been studying a lot of state mandates for quite some time, and I think New York, Colorado are among the forefront of really good work that has been done. I'm going to go from left to right in terms of the areas that they have established mandates on. On the left side is New York Hospital Cyber Mandate. So that's very, very focused. This went into effect October 2, 2024. And, organizations, hospitals in the state of New York, I would highly recommend anyone who's from the healthcare industry, especially hospitals or health systems, even outside the state of New York, take a closer look at this because it can enrich in your HIPAA compliance program. Next to it is the New York AI Cyber Mandate. So there's a separate cyber mandate that has been established by the state of New York. Take a look at that. I thought it was really well done in terms of the requirements that have been identified in the AI Cyber Mandate. And then you have the AI Cyber Security Mandate. These are all distinct mandates. You can think of these as layers of mandates that organizations have to comply with. So all of these are mandates that I would at the very least be knowledgeable about because they may give you ideas to enhance your compliance program. Now, I've included a couple of slides just to give you a little bit more insight in terms of, okay, so what is in these mandates? So here, this one is particularly focused on the New York Hospital Cybersecurity Mandate. And I want to comment on a couple of things. Number one, designating a CISO, Chief Information Security Officer. Though this is not like taking a person in HR and saying, hey, John, you're now going to also be designated as our CISO. No, it doesn't work that way. You got to make sure that this person who's going to be assigned this responsibility has the skills, has the knowledge, has the time, has the resources to be successful in that role for a CISO. Conduct annual security risk assessments. The word annual is missing in HIPAA compliance, although every organization should be looking, when you look at HIPAA compliance, to perform risk assessment exercises annually. But if you read the HIPAA body of work, the word annual is missing. New York is very, very specific to ensure that these exercises are in fact being performed on an annual basis. Implement a cybersecurity risk program. Organizations should be looking to perform vulnerability scans, penetration testing. Typically, these scans are on a quarterly basis. The penetration testing is at least 1 hour. Audit trails to detect and respond to events. Multi-factor authentication, like I mentioned, privilege account management, equally important. Review user access privilege to make sure those are appropriate with the roles. Really critical, establish an incident response plan because when it comes to New York, the response timing is 72 hours that you've got to inform the Department of Health or other impacted departments and provide cybersecurity awareness training. So you can see the New York mandates are much more prescriptive than what we've seen, for example, with HIPAA. Like I mentioned earlier, 72-hour incident reporting. So all of us, and this just went into effect. You can see the date here, October 2025. So organizations, as you're looking at your HIPAA compliance program, your cybersecurity program, it's very important to make sure that you are looking at New York to raise the bar for compliance within your organization. And so here specifically, when we are looking at risk assessment, the cybersecurity program should be able to identify, assess cybersecurity risk, which is where you're performing the risk assessment exercises at least on an annual basis, quarterly vulnerability scans, at least annual penetration testing to protect hospital information systems. You must be able to detect, respond, and recover on a near real-time basis, which means you got to have these tools and technologies that are deployed within the organization and ensure that you're meeting statutory regulatory requirements. The New York AI cyber mandate goes beyond the original, though some of you may remember 23 NYCRR Part 500. That's the foundation that all of these mandates in New York are building towards. And so the AI cyber mandate, I thought, was amazingly well articulated. And the key acronym here, everyone here is familiar with PHI, Protected Health Information, because when we think of HIPAA compliance, we think of PHI, Protected Health Information. When we think of AI risk, we should think of this third button on the right, non-public information, NPI. So the objective of this mandate, the New York Cyber Mandate, is to ensure that we are appropriately protecting NPI within the organization. Cybersecurity is about your overall program, your policies, procedures. Very important to remember the CISO role, appoint a qualified, that's the key word, qualified Chief Information Security Officer, because many organizations had just designated the role without that individual having the appropriate qualifications. Multi-factor authentications, annual assessments, these are all really, really important for organizations to make sure are integrated within their compliance program. And then New York has also introduced requirements as it specifically relates to ransomware. So if you've paid the ransom, this is not there in many other states, but I think the other states are going to have these mandates sooner rather than later, is that if there's a ransom paid, you got to report within 24 hours, no ransom paid, then report within 72 hours. And then post-payment report, make sure that you put together that report of the analysis in terms of what happened with the ransomware event, no later than 30 days. So really important as you're looking to articulate and put together a credible ransomware readiness program within your organization, that you look at the New York mandate. So there's a lot we've covered here. As I look to close my presentation, I wanted to close with some words of wisdom, so to speak. Kind of where have we been in the last 12 months that we can learn from to position our organizations in a better space and time, and to establish a more resilient organization in 2026. That's what we'll be looking at in some of my closing remarks. So this comes directly out. Wherever possible, I've provided the source. Gen AI won't replace people, but people who use Gen AI will replace people who don't. So that's important. We gotta be knowledgeable. That's why, as I shared, all of these bodies of work, it's very important that we read these bodies of work, that we're knowledgeable about it. So the past has always been and will continue to be in terms of making sure we are continually complying with the HIPAA mandate. So HIPAA privacy rule, breach notification, which is high-tech, HIPAA security rule. On the right side, really important that we are familiar with, at least knowledgeable about, the NIST body of work and the ISO body of work. And to me, really the future where these roads all integrate, they come together, is ISO 27090. Keep a close eye on that. And then an area that is what I refer to as HIPAA's blind spot. Connect to me over LinkedIn or send me an email. You'll get my email at the end of the presentation, or send an email to anyone at WellLink, and we'll be happy to get you an article that I just put together, HIPAA's digital blind spot, which is online tracking assessment. Organizations, if you haven't performed it, you should be looking to perform this at least annually. State of business AI, in terms of where are you with AI right now? What AI products have you implemented? What AI technologies have you implemented? What's the state? Because that introduces a risk to the organization. And I think a question that you need to be answering on the bottom left, what type of AI-ready framework are you using? Are you aligning your work with AI from a governance perspective with the NIST body of work? Are you aligning it with the ISO body of work? Or are you aligning it with high trust and achieving certification for the AI capabilities that you have implemented? It's really, really important that we cannot go into 2026 not knowing the answer to that question, AI framework. So as I get really close to the conclusion of my presentation, 2026, here we come, right? We are just a few weeks, 3-4 weeks away from that. We gotta continue to enhance our HIPAA compliance program, which is on the right side, but we gotta move to a newer dimension in terms of AI risk management, which is all about your AI governance. So let me just go through and peel layers of the onion. Number one, on the left side, know the AI risk management framework. You got to identify that, which framework. Identify all of your AI related assets, scoping. What is in scope for AI risk management? What is it that is not? You must build a appropriate library of AI specific plan and policy documents. Perform an AI focused cyber assessment. Ensure that you're mitigating, remediating the risks that have been identified in terms of the corrective action plan. And this is a life cycle. You got to repeat it. So AI risk management is really, really important. ecfirst, the organization I'm with, you'll see we deliver the industry's leading HIPAA certification training program. And we've introduced the AI CRP program, AI Cyber Risk Professional. It's online, self-paced. So take a look at that. And we are also the first organization, very excited to be collaborating with WellLink on this, where we've introduced an AI playbook. And this is available on a subscription basis, both for AI and for HIPAA. Now, send a note to your contact at WellLink. We'll be happy to share some of these infographics. It's all complimentary. I think it's really valuable. I use it all the time to kind of go back and recheck some of the things that may be in each of these mandates. And then we did not have much time to dive into Colorado, but Colorado is another state that is doing amazingly good work when it comes to AI governance and AI risk management. So with that, I'm going to close my presentation. One last comment when we look to the future. Look at the top right. If that doesn't get you excited, I don't know what will. So this is the publication I was reading recently. And right there, when it was showing the name of the author, it said US Department of Homeland Security. And look at the title. Look at the title. Chief AI Officer. Anyone who's a compliance officer, anyone who's a compliance professional, I think this is a role that we're going to see emerge with tsunami force across the healthcare industry. So it's very important to acquire the knowledge so that which comes from these governance bodies of work that we've been discussing. And then don't hesitate to request this complimentary T-shirt. In God we trust, the rest we audit. I cannot thank the entire team at WellLink. There are so many people that I've been working with. Brian Lane, Endred, they're just a whole volume of names. Very grateful. For me, everything comes down to humility, very humbled, very excited to have this opportunity to present. And with this, I'm going to transition it back to my good friend, Brian Lane.